Okay, so today I'll be going over a medical patient assessment. The first thing you'll want to do is the scene size up. So you want to make sure that the scene is okay, it is safe for you to be on the scene. And then you will want to determine the nature of the illness, which in this scenario will just be chest pain and slight difficulty breathing. After that, you will want to determine the number of patients. In this scenario, it'll just be one patient. If there were several patients, you would have to determine which patient needs your help the most. Like we said earlier, one patient, so no need to worry about that. And then you would have to determine whether or not the cervical spine needs to be stabilized. In this scenario, you would not need to do that. And now I can begin the primary assessment. I would first verbalize the general impression of the individual. This would include things such as the gender, the age, and the ethnicity of the individual. I would then introduce myself and ask them if they wanted my help. If the individual is younger than 18 years of age, unless they are in very critical need of my assistance, I would need to first have their parents' permission. Next, I would have to determine the chief complaint, which, as we said earlier, is chest pain and slight difficulty breathing. Then I'd have to determine the responsiveness of the individual using the AVPU. So I need to make sure that they're alert, they can verbally communicate with me, and that they can feel their pain, and that they are responsive. After which, I would do an airway assessment, which can be done by simply looking down their mouth and seeing if something is obstructing their airway. After that is the breathing assessment. So you need to make sure they have proper ventilation and enough oxygen. In this situation, they do have some slight difficulty breathing, but not to the point that they need to be administered oxygen to stay alive. If you have oxygen available, it is not a bad thing to give them some. So next would be the circulation assessment. So this is when you would control major bleeding, if there was any, which in this scenario there is not. You make sure that they're not going to shock, and then you would assess their pulse, skin, and capillary refill. After assessing all these, I'd have to determine if they need to be transported. In this scenario, they do not need to be transported. After that, you would go over their history, so their signs, symptoms, allergies, pertinent medical history, their last meal, and the events leading up to their chest pain in this example. After that, you would do the secondary assessment. So you would record their blood pressure, their pulse, and their pupils. After doing those vitals, you would redo the primary assessment and their vitals one more time, just to see if anything changed from the first time. That's it.